Time now for Ask the Expert, and a topic no one really wants to talk about: urinary incontinence.
This can happen when you cough, when you laugh, when you sneeze, or you jog. Dr. Brian Baird joining us live this afternoon to talk about this. This is uncomfortable for a lot of people to deal with. So what is it?
Well, incontinence mainly involves the involuntary loss of urine, either with or without effort. And when we say with effort, it's what you just described. Coughing, sneezing.
You exert yourself somehow.
Exert yourself. And it varies. Some people lose a small amount of urine, some people lose a large amount of urine and become homebound. But what's interesting is it affects millions of adult women, and about 80% of them consider it bothersome, and about 30% of those consider it affecting the quality of their life where they can't leave their home.
And sleep. I know, people who get up constantly throughout the night, and that's obviously disrupting your lifestyle. What are the symptoms?
Well, there's three main symptoms. One is stress incontinence, coughing, sneezing, and the untalked about thing, having sexual relations. That's what keeps a lot of people away from the doctor. The other is urge incontinence, where when it's the age-old, when I gotta go, I gotta go. And then lastly is an overactive bladder, where people have to go just often.
Okay, what do you do if you start to feel these things coming on?
Well, I encourage people to go in and have a discussion with their physician and get referred to someone who can take care of these problems. Gynecologists, urogynecologists, and urologists all deal with these issues.
What are the treatments? Do you have to have surgery, or are there other things you can try before that?
Well, it's a great question, and the answer is realize first of all it's a medical condition, and you have doctors that can help you. And there's conservative versus surgical management, and the conservative management is the what everyone's always heard: Kegel exercises, squeeze and hold, and try and hold it in and improve the pelvic floor. The other is behavior modifications, like limiting your fluid intake or going to the bathroom more frequently. And the other involves, for people who have pelvic organ support problems, putting in something to hold things up, which most people look at you and go, "Are you talking to me?" And then lastly is surgical intervention.
Okay. Dr. Baird, thank you.
You're welcome.
Got a question for our experts? Send them an email, asktheexpert@tmj4.com. You can also leave a voicemail at that number on your screen.